The final area that we're going to be covering is clinical psychology, and clinical psychology is when we'll talk about psychological disorders. But we don't want to just use the term psychological disorder in a willy-nilly kind of way. We want to apply it consistently so that people understand what it means to have a psychological disorder. So what we mean is that behavior is deviant, which means it's different than the typical person. It's sort of abnormal, atypical. It's distressful, either to the person who's having the behavior or to the people around him. And it's dysfunctional, meaning it causes him problems in his daily life. In order for something to count as a psychological disorder, it has to be all three of these things. The way that psychologists do diagnosis of disorders is by using this manual called the DSM-4. And the DSM-4 just means it's in its 4th edition. There's actually a 5th edition coming out in the next year or two. DSM stands for Diagnostic and Statistical Manual of Mental Disorders. This is put out by the American Psychiatric Association, which is the big psychiatric body in the United States. And the way that it's laid out is it talks about all of the different disorders and what specific symptoms would fall within that disorder. So this helps clinicians make sure that they try to make the best diagnosis possible. Now, it's not the case that they make the right diagnosis all the time, though. Like the world of medicine, there is always some error and there are some different opinions, but this tries to standardize disorders as best as it possibly can. So all psychologists should be functioning out of this book in the United States. There are some problems with just diagnosis in general, in particular the problem with labeling. So what happens if you get labeled with a particular psychiatric disorder? Well, there often come things like stereotypes or biases. And there was a particular study that was looking at whether labels can cause biases in the way that we perceive people by a guy named Rosenhan. And Rosenhan basically sent some graduate students and other people into psychiatric institutions. And this was over 50 years ago, back in the day when there were a lot of psychiatric institutions. And he had individuals act like they had schizophrenia. They were supposed to go to these various institutions and try and check themselves in, saying that they heard voices, and Rosenhan wanted to know whether they would A, get admitted, and B, if they were admitted, how long it would take for the staff and the doctors to figure out that they didn't actually have a disorder. Shockingly, what happened is that none of them were identified as not having the disorder. They were all allowed to check themselves in, and nobody showed any suspicion of any of these people who were faking the symptoms. What was supposed to happen is when they checked themselves in, they were supposed to stop reporting any symptoms. The only time that they ever said that they had any symptoms of schizophrenia was when they said that they were hearing voices. And then they were supposed to act totally normal once they got checked in. But what happened is that oftentimes people would assume that that's what they had, schizophrenia, because the label had been put on them, and then start to interpret their behavior as such. So for example, one of the guys was writing notes, and the nursing staff had made a note saying that he's making a list of paranoid delusions, when in fact he was just simply writing notes. After the news came out that these psychiatric institutions had not found a fake patient, there was a bunch of hubbub, and people wanted to know, well, is it the case that there are lots of people who are checked into these institutions who shouldn't be? And the institutions defended themselves by saying, well, we didn't know we were supposed to be looking for fake people. Our efforts are to try and help individuals, not look for fakes. So Rosen had said, okay, fair enough. What I'm going to do is over the next 6 months or a year, I'm going to send somebody to your institution, and I want you to point out, catch the faker. And so he did that, and what happened is they didn't catch any of the fakers again. So there were some major concerns about institutions. This, in addition to the One Flew Over the Cuckoo's Nest and other kinds of media, started to point to some of the major errors in these kinds of institutions, and they eventually have gone away largely. Also, the media tends to misportray a lot of psychological disorders. They promote a lot of stereotypes and false information. For example, a lot of people think that schizophrenia and multiple personality disorders are the same thing, and they're actually not. They're different disorders. So the media's portrayal of the psychological disorders is often inaccurate. You should always be skeptical when you see things on the TV about people who have certain disorders and whether that is an accurate representation of what it really means to have that disorder. But on the good side of diagnosis, one of the things that has started happening in the past probably 15 to 20 years is the stigmas of having disorders has decreased. This is especially true when you start talking about things like depression. So people are more open about having disorders. Diagnoses are also good because it increases communication and understanding. So if a person is having problems in their daily life and they're able to go and see someone and get a diagnosis, it often can help them understand why they're having those problems. And sometimes people find it a relief to know that there's a reason and that maybe there's something that they can start doing about it now. A final idea before we get to the specific disorders is an idea called comorbidity. And comorbidity means that it's very possible to have more than one disorder at the same time. And actually, it's quite likely. Numerous people have more than one disorder. So if we look at all of these disorders, and we'll start with the yellow circle of depression, you can see that next to it is the pink circle of panic disorder. The yellow circle represents all people who have depression, and the pink circle represents all people who have panic disorder. But there's that area where the pink and the yellow overlap. And that's a subportion of the population who would be suffering from both depression and panic disorder. And this is very common, so keep it in mind, comorbidity, the idea that a person can have more than one disorder. Now, there are lots of different types of disorders, and I would like you to read about each one specifically in the book, but I'm going to lay them out here. There are mood disorders. This includes things like depression and bipolar disorder. There are anxiety disorders, for example, post-traumatic stress disorder or phobias. There's schizophrenia, which is actually a type of psychotic disorder. This is a very specific disorder, not a class like the two above it. Personality disorders is also a class of disorders, so for example, antisocial personality disorder. And then finally, dissociative identity disorder. This is what people often refer to as multiple personalities disorder. It's actually not a personality disorder, and it's not schizophrenia. It's its own kind of disorder called a dissociative disorder. This is not an exhaustive list of disorders, but these are the ones that the book focuses on and the ones that I want you to read about.